Hello, everyone. Happy March. I'm Andy Dwyer with the University of Colorado Cancer Center, Colorado School of Public Health, and our statewide Colorado Cancer Coalition. I'm delighted to have all of you join today for the promotion and awareness around colorectal cancer screening, and as our lovely lobbyist has said, to run the victory lap on several different initiatives that have been launched throughout our state. We'll be hearing from our legislators, our policy champions, our survivor advocates, and we'll also be hearing from some of our key leadership within the Colorado Cancer Coalition. Before I move to having our legislators and policymakers joining us today, I'd like to give a huge shout out to Fight Colorectal Cancer, Exact Sciences, the Coalition, ACS CAN, who have really helped levitate and leverage, not levitate, but we can do levitation as well, really the policy and the prevention and awareness efforts that have happened throughout the federal and the state legislation. So thank you to many of you for all of that great work. I'd also like to thank our Office of Community Engagement from University of Colorado Cancer Center, 9 Health, a number of our team members from the different health systems who are joining us today, some of them from rural Colorado. I know Cheyenne County is in the house, as well as a number of our other champions, such as South Metro Fire, who Chris Macklin will be joining us to share as well some of the specific work that's been happening throughout the county and throughout the work here to really promote colorectal cancer screening. I'd also like to just remind everybody that this is actually March is CRC Awareness Month. We started March 1st, but it's been great as the Biden administration, Governor Polis, and many have already designated Colorectal Cancer Month as March and already done a huge shout out. I know that we've actually seen President Biden talk about the Moonshot Initiative, and even in his remarks last evening, talked about the role of prevention and the work that we should be doing in cancer early detection. So I'm really thrilled to have all of you here today. I'm going to turn over the mic to Senator Buckner, woo, who's now joined the show. And then we'll have Representative Will, Representative Byrd, and then we will see if Senator Priola is able to join us. But we'll go ahead and turn it over to Senator Buckner. Thank you all.
Thank you. I just came from another press conference. I am so honored to be here today. As many of you know, over the last few years, I've been the champion for colorectal cancer because of how it impacts my race and how it impacts my community. We all know that cancer is the leading cause of disease in Colorado for all cancers in general, but communities of color are disproportionately impacted. Colorectal cancer impacts communities of color at higher rates in Colorado, specifically the African American community. Colorectal cancer screening rates are substantially lower for Hispanic Americans at 65% and Black Americans 68% compared to those who are non-Hispanic white, which is 75%. Black and Hispanic Coloradans are more likely to use stool-based testing at higher rates, so removing the out-of-pocket costs for a follow-up colonoscopy is really exceptionally important and critical to achieve health equity in communities of color. This was a big success to have the Biden administration clarify that this should be covered as a benefit, and we need to work hard to implement this in Colorado. I have no regrets for all the work I have done for the last several years, because now with this coming to fruition, we know that less people will die from this disease. Those who do not have to die will still be with us. So I'm emotional because this has been a long road, but thank goodness we did not give up. So now I would like to call on my friend, cousin, Representative Will.
Thank you, Senator Buckner. I was going to do a call out to my capital cousin too. I give another call out to Andy, my other cousin. So, colorectal cancer impacts men and women at almost equal rates. Unfortunately, it's the third most common and the second most deadly cancer in Colorado. Rural communities like I represent, particularly in my district, have higher rates of colorectal cancer, yet access for care and prevention and early detection for colonoscopies can be very difficult to access for people who live in the Colorado rural communities like I represent. Rural Coloradans are more likely to have public insurance or be uninsured compared to urban Colorado. So Medicaid deciding to include colorectal cancer as a screening quality measure will ensure colorectal cancer has more attention, and those with Medicaid will likely see greater improvement in care and access to the colorectal cancer screenings. You know, cancer is expected to be the leading cause of cancer death for those in the ages 20 to 49 by the year 2030. That's an interesting statistic. We really need to push more work towards prevention, and especially for colorectal and lung cancer. So let's keep our focus on this and keep moving forward. Reducing the age for the screening, Senator Buckner and I had that bill, and we're getting increments, but we need to keep the pedal to the metal and keep our foot on the gas pedal on this, keeping it moving forward, especially for prevention and screening. So thank you. Appreciate it.
Now have Representative Bird.
Oh, sorry.
Hi there. I'm Representative Shannon Bird. Thank you all for being here. And at the risk of repeating certain statistics, I'm going to do it anyway because it's so important. Early detection, we know, saves lives. Sadly, according to the American Journal of Gastroenterology, colorectal cancer diagnosed under the age of 50 is on the rise and is no longer considered unusual. And I'll just say, I am part of the large population that believes that this is something that targets only certain demographic groups, and it's not me. And research proves that that isn't the case. Research suggests that someone who was born after 1990 has double the risk of colon cancer than someone who was born in 1950. So let that sink in. It's not the population that we think it would normally impact. It's younger people as well. This demographic also has 4 times the risk for early rectal cancer. Colorectal cancer is the 3rd most common type of cancer in both men and women, and as Representative Will indicated, it's the leading cause of cancer in ages 20 to 49, or it's expected to be by the year 2030. That's not that far off. Colorectal cancer is preventable if we get the screenings that we need. Unfortunately, though, we know that screening rates are not adequate right now to prevent this potentially devastating cancer. Only 50% of those eligible total, regardless of race or income group, are estimated to be receiving this screening. And only 27.6% of those who are eligible to be screened but who are uninsured are currently getting this screening. So we know that sometimes cost is a barrier. Sometimes the time necessary to prepare for the medical procedure is a barrier. And sometimes it's just people's general reluctance to obtain this really crucial type of healthcare that is a barrier. Access to preventive screening services should be available to all Coloradans, and we need ongoing support for colorectal screening to be a priority in our state. Because this is a preventable illness that is no longer a rare affliction, we must do all that we can to get the screenings we need and to support and encourage our loved ones to do the same. You never know, the life you save might be yours or someone you love. Thank you again for being here today.
So I'd like to say a huge shout out to our legislative sponsors who are here today, and Kevin Priola, who was not able to join us. But again, a huge round of applause for these individuals who really have taken up the time and energy to really help spearhead this work. And I think Representative Bird had talked a little bit about the screening rates and where we are. It's stagnant around the 50 to 60% rate. I'm actually excited that some of our FQHCs and those working with the medically underserved in Colorado have really taken this as a huge initiative, to the point that Pueblo Community Health Center in Pueblo actually is the recipient of the National Navigation Roundtable's grand awardee looking at some of the biggest gains for preventive screening within southern Colorado. So these are the kind of efforts that are happening here. We want to continue this great work for prevention and early detection, and also to continue that awareness and reduce stigma around the disease. We also spoke today about preventive screening in those in the young, the increased incidence that's happening, and how we're really going to tackle that within our state. We have a number of survivor advocates who are joining us today to share a little bit about their journey, about the message they would like to share, as well as celebrate people that they have lost, but also to really talk about how we're going to continue, as Representative Will talked, with the pedal to the metal and keeping on that gas. So I am delighted to have Jelena Tompkins, who's going to join us first to share about her journey as a young survivor. Megan and Chris from South Metro and the team to share and honor Tony's legacy and the work and all of the great awareness and all of the person he was, and really celebrate his memory today. But I think it's really important to hear from those who have actually walked the walk, who've been through the treatment, who've really experienced what the impact could be, to really think about the direction that we're moving ahead. So Miss Jelena, I'm going to offer you up to the stage to begin.
Thank you so much, Andy. Good afternoon, everyone. As she's mentioned, my name is Jelena, and I'm here to speak about the patient perspective on these wins and what more that we can do to help younger adults that are being diagnosed with this disease in greater numbers. A little background on myself. I was diagnosed with stage 3 rectal cancer at age 34. I had 0 risk factors, including no family history, and had symptoms for nearly a year before I was diagnosed. I was blissfully living my life as a mom, a wife, a recreational runner, thinking that I was doing everything right to be healthy and to avoid getting cancer way down the road when I got older. I never would have imagined that I would be diagnosed with cancer at 34. I had only ever heard of colon cancer and had no idea that rectal cancer even existed, which demonstrates the need for more education and more awareness. Now, after having gone through treatment and getting to know countless other patients, I know more about it than I ever would have imagined. Being a young survivor, I'm happy to see the colorectal cancer screening age being lowered from 50 to 45. Regular screening in adults 50 and older has led to a decline in colorectal cancer deaths, which tells us that screening saves lives. Unfortunately, colorectal cancer is on the rise in younger adults, as we've heard, and we're just going to keep shouting this until everyone knows. Colorectal cancer is going to be the #1 cancer killer in adults aged 20 to 49 by 2030, which is just 8 years away. My hope is that this decrease in the screening age will lead to more doctors understanding that colorectal cancer is not just a disease that older people get, and they'll be more thorough in testing and following up with patients that come in to see them with these symptoms. Which brings me to the next victory to celebrate, the elimination of the out-of-pocket expenses for a follow-up colonoscopy after a positive at-home stool-based test. These tests are supposed to make it easier to screen adults that are of an average risk, but if a patient receives a positive test and has to pay for a follow-up colonoscopy, that didn't really make the screening any easier for the patient. So covering the initial at-home test and the subsequent colonoscopy just makes sense if the goal is to catch colorectal cancer before it is spread. The cost of that follow-up colonoscopy pales in comparison to the cost to treat colorectal cancer. My cancer had spread to lymph nodes, so my treatment lasted for a year and included radiation, 2 different types of chemotherapy, and 2 different surgeries. I was lucky to have an end to my treatment, but the financial cost added up to hundreds of thousands of dollars. And that's just for one person. How many people could have been screened after a positive at-home stool-based test for that amount of money? Early screening not only saves lives, it saves money for both the patients and the insurance companies. Early screening also will improve the quality of life for those people that have colorectal cancer caught early. Treatment is rough on the body, whether you're young or old. The end of this month marks the 5-year anniversary of me finishing my last round of the IV chemotherapy FOLFOX. Thank you. This is the standard chemotherapy that stage 3 patients undergo, and it causes a mess of side effects that can last for years. My immune system took a pounding, and even years later, my numbers are still up and down, which was frightening when they took a dip at the height of the pandemic. Chemotherapy weakens bones, and I've got the early stages of osteoporosis. Back in December, I broke my ankle while I was out for a run, something that shouldn't necessarily happen to a normal, healthy 40-year-old woman. But here I am almost 3 months later, and I'm still walking awkwardly with an ankle that's still swollen. 28 days of radiation put my body into premature menopause at 35. That also puts my bones at a higher risk of weakening, but also puts me at a higher risk of having a stroke or a heart attack, all of which is something that a 30-something-year-old woman shouldn't really be worrying about. I also have to take medication daily to keep my hormones at a level appropriate for a woman my age. Lowering the screening age and eliminating screening out-of-pocket expenses are great victories, but there's still plenty of work that needs to be done. Lowering the screening age won't help save lives unless the people know that they need to be screened. We need to work harder to get people to understand the importance of screening and improve access to it, especially in our rural communities and communities of color. I'm considered an early age onset colorectal cancer survivor since I was diagnosed at 34. And patients diagnosed at a younger age have additional needs that aren't fully being met. My daughter was only 5 years old when I received my diagnosis. So in addition to worrying about the treatments that I was about to undergo, I also had to figure out childcare because I couldn't just bring her along with me to radiation treatments, and there's signs at the chemotherapy infusion center prohibiting children under the age of 16 to enter. Quick decisions have to be made about fertility preservation, and the option of seeking this route comes with the caveat that your cancer treatment is delayed while this happens, and you're taking a chance that your cancer could spread even more. Our mental health declines because we see others our age starting and expanding their families, going on vacations, and enjoying the prime of their life while we're stuck getting chemotherapy and taking naps like it's an Olympic sport. The advances we've made are a great start, but to truly make a difference in lowering the colorectal cancer rates in Colorado and supporting those that are diagnosed, we need to keep that momentum going. We need to push to make sure all Coloradans know when they need to be screened for colorectal cancer and make it easy for them to do so. We have the power to make this happen, so let's save some lives.
So Jelena is one of the many voices, and I know there's several out there who raise your hand if you're part of an advocacy team. I know that there's a couple of teams, and Jelena has been an amazing voice for early age onset and young folks. And as much as she talks about, really, of course, the side effects and the impact, this woman can hike a mountain. I was right behind her, and you are really a force. And what I'd also say to Representative Will, join the cause. That is blue hair. That's really about awareness, and you are doing amazing work. So, Jelena, I think you bring up so many good points. Really, we're talking about prevention and awareness, but it is really about survivorship, carrying that message, and what we can do to continue to support cancer survivors as well. I'd like to actually have Megan, team, Chris join us and share a little bit further about some additional stories and really sharing the life and memory of Megan's husband, Tony, who's one of the great heroes within the state who's been part of the EMS and firefighter team. So I'd love for you guys to join us to share with us today some of your perspective.
Bear with me, please, as I try and get through this. My husband, Tony, passed away 5 months ago from colon cancer. He leaves behind myself and my 2 daughters, 16 and 22. Tony's been a firefighter paramedic for 30 years and with South Metro for the last several years. Tony was diagnosed at the beginning of 2017, routine colonoscopy with a rather large tumor. He was stage 2 at that point. And over the past 4.5 years, we did multiple treatments, did include radiation and chemo and some alternative therapies as well, with a lot of celebrations and heartache along the way.
remission, now it's back. Remission, now it's back. And ultimately, this last year, it finally, his body couldn't keep up with it any longer. Tony served the community for a very long time, taking care of others. And ultimately ended up with colon cancer for his line of work, which he wouldn't take back if he could do it all over again, and he always said that. But because of it, it also has helped to bring awareness to our firefighter community for better ways of protecting them from the everyday job-related toxins and hazards that they come across. It's been a lot on our family the last 4.5 years, financially and emotionally. And it is important to get those screenings done early and get treatment done as soon as possible. Thank you, Chris.
Thank you, Megan. I knew Tony since 1991. I worked at a mom and pop ambulance company here in Denver called Reed Ambulance, and that's when I met Tony. I met you not long after that. And we went our different ways, and we were reunited in 2018 when Tony's fire department came into South Metro. We know as firefighters, we are at a greater risk for 13 different cancers. Modern construction is laced with chemicals and plastics, and when those burn, those chemicals are in our gear, they get underneath our gear. We have a presumptive cancer law in Colorado, but the pendulum has swung back and the burden is on the employee and no longer to prove that that cancer is related. Tony's previous employer discouraged him from filing a workers' compensation claim. And in 2018, when he came to South Metro, we fought for Tony in that claim, and we prevailed with Pinnacle as that carrier, and we were able to. And what that did is it honored Tony, it honored his occupation, and it honored Megan and her daughters that Tony gave them the living and the life that he always said he would, and we were able to do that for you. And I think that's what. Sorry, Andy. I think that's where I'll leave it back to you.
Awesome.
Okay.
All right. Well, thank you guys. Thank you so much. We really appreciate you being here today. Thank you. So, thank you. And I really think the message of Tony and the impact, and I think that he's been great when I've visited the firehouse and really understood the impact. And I believe, Chris, he's being honored in most of the Denver Metro firehouses, and his voice is.
I'm sorry. I should have. Yeah.
Well, I'm going to.
I apologize.
No.
This isn't my thing. And so, this is Colorectal Cancer Month. At South Metro Fire, we cover 300 square miles south suburban of the Denver metropolitan region out of 30 stations. We serve a population of about 550,000 citizens. This month, we're going to honor Tony. Tony, since 2018, Tony was only able to work for about 600 days. And what I do today is I'm our wellness director. And so I help take care of Tony. And we have strength coaches, and we have a fitness test, a VO2 max test, and Tony wanted to get to 12 METs. And he was so upset because our coaches were so worried about Tony's physical state that they stopped his test at 11.9, and he was so upset. And in that moment with one of our strength coaches, he said, "I have no quit. Like, why did you stop me?" And Megan and Elise will tell you that his voice went up 10 octaves when he was upset, and he was so upset. And so anyways, this month, we're going to be putting Tony in all of our station gyms and at our headquarters, a fat head with that saying, "There is no quit," right, to raise the profile of colorectal cancer in our department and in our industry.
Awesome. Well, and I just want to say that there's recent data that suggests that even young people are oftentimes diagnosed through emergency medicine and emergency rooms versus primary care. We also know susceptibility, as Chris had talked about, for firefighters. And I think we're really, through our statewide coalition, working with Night Health and others, really thinking about that voice and that fighting spirit of heroes and prevention. It impacts firefighters. People are really using emergency medicine to be diagnosed. Like, let's change that and get the heroes and folks who are the invincibles, the Chris, the Tonys of the world, really in the front and center to talk about the risk and really being a part of that work. So I really appreciate that. I'm going to join from all of the survivors and advocates. Thank you. Big round of applause. I'm going to, awesome. I do want to say a special thanks. I'm going to have Allie Bain from the American Cancer Society join me here in the closing as a chair of our statewide cancer coalition. I'm the outgoing chair, so this is a bit of my swan song today. But I also want to say thank you, Emma Hudson, for all of the great work. You know, we talk a lot about that this is a passion. Both of us have family history of colorectal cancer. I called her at the 11th hour and said, hey, let's look at how we can support this work together. She said yes. She really helped foster a lot of the collaboration with our with our policymakers and all today. So all of those who are really here, ignited by your own experience, thanks so much for joining. I'll have Allie share a few comments, and then we'll close us out for the day.
Thanks, Andy, and thank you for your leadership on the coalition and your leadership in all of the work with colorectal cancer in Colorado. Thank you to all of you for sharing your stories, for being our champions, and I think you've already heard it. Now is the time to keep the pedal to the metal, to keep going. So we know that this is a priority with the Biden administration and the moonshot. We know this is a priority with the Colorado Cancer Coalition, and we know this is a priority at the American Cancer Society. So what better time to come together, to work together, and to save lives from colorectal cancer. So thank you all for coming. I hope you have a great week, and let's continue this fight together.
So to close us out, what I do want to say is I know that next cycle we are, through the university, through the coalition, ACS, talking about that decrease of barrier, access to care, impact on communities, talking about the potential for community health work, navigation, and how do we really unite with our breast cancer community, our lung cancer community, and others to talk about preventive screening holistically. What can we do independently? What can we do together as we continue this work moving ahead? Really excited about March as Colorectal Cancer Awareness Month, but really also thinking about how can we really excel these opportunities. What Megan, Jelena, Chris have talked about, really that barrier reduction, that access to care. So we're going to be meeting with all of you, our thought partners, to keep the pedal to the metal. I really love that you said that, Representative Will. It's been a theme for today. So we'll go ahead and continue that over the next year. This year, be back next year to really continue to think about this access. Thank you all for coming, and again, let's continue March as CRC Awareness Month and keep the energy moving. Thanks for joining us.